Okay, here's the movements I want your finger to be able to perform actively and passively. Let's identify, this is the metacarpal. Here's the thumb post. It's like the metacarpal of the thumb. Here would be the first metacarpal, proximal phalange or proximal phalanx. So this is the metacarpal phalangeal joint, just flexion and extension. Here's the middle phalanx. So here's the proximal interphalangeal joint. That's passive motion, right? Here's the distal phalanx. So this is the distal interphalangeal joint. Inter, between the middle phalanx and the distal phalanx. Here's our little lumbrical. You can see on this side it goes in front of the MCP joint and then goes to attach along with the extensor digitorum all the way posterior to the PIP and DIP. This is our flexor digitorum profundus, which is anterior to the MCP, PIP, and DIP, and our extensor digitorum posterior to those same three joints. Here's what I want your finger to be able to do. It should flex when you pull the flexor, and here it's flexing at the MCP, PIP, and DIP. It should extend when you pull extensor digitorum. It's hyperextending a little at the DIP, but extended everywhere. And I'm just passively ranging it to get a little slack in these extensor tendons. And when I pull on the lumbrical, we're going to want to see flexion of the MCP and extension of the IPs. So here we go. Okay, flexion of the MCP, extension of the IPs. Here's flexion of all the joints, extension of all the joints. Sometimes when you pull on the flexor digitorum profundus, it doesn't flex the DIP because there's too much tension in the extensor digitorum. So pull that out distally to give it a lot of slack, and then when you pull on the flexor digitorum profundus, you'll see flexion at all those joints. Flexion, extension, and then lumbrical.